I'm very concerned about the inability of loved ones to see patients in hospitals and other care facilities. Do you have any comments on that? Have you had any complaints about that? Do you face that at all? I'm particularly concerned about people with special needs who get pushed into a hospital and then they lose contact with the world because they're totally confused. We've had the same kind of problem with senior citizens. Any comments on that?
Absolutely. You know, we, under the, I guess some of the guidance of state legislators, we also put forward a letter asking for our hospital system to consider something like compassionate care helpers, which was especially during COVID-19 and the pandemic, we saw people just being isolated with no advocacy. So trying to put some sort of familial support in the room, someone who could maybe speak the same language, who is culturally humble and understands that some things are harder to express, advocate for, or talk through. And so we've certainly been trying to push for a system that allows, again, that familial support with these people who are very, very sick. It's happened with our senior citizens, people who speak English as a second language, people particularly with special needs, and certainly our immigrant community. So when we put forward that letter, and a pilot program was implemented in health and hospitals that I believe will potentially become permanent, it was also looking at some of the guidance. I believe the letter was penned by Lenthal in the State House. So we certainly want to continue that advocacy. I mean, I know I even heard from faith-based and clergy leaders that they were the only people in the room many times trying to help that person FaceTime a loved one, which is very, very heartbreaking. So we want to make sure that that situation doesn't happen again in the case of a second wave, or just, you know, throughout the health services system ongoing.
Yeah, I had wanted to ask the commissioner and ran out of time because of our limitations here about if he had any numbers to show transmission to patients of COVID from visitors. When we're talking about nursing homes, there apparently was, according to the nursing home industry, they only had one documented case where a visitor transmitted a COVID to a resident. And I was wondering if there were any numbers with respect to patients getting COVID while they were in the hospital, and then whether it came from a visitor or somebody on staff. But I don't know that there are any of those numbers out there without, you know, foiling them, basically.
Well, thank you for bringing that up. I mean, I've been concerned by the State Department of Health's lack of transparency and response, certainly to your questions around this over the past few weeks and in your previous hearing. I think the data behind nursing home transfers, particularly to hospitals and deaths, must be publicly released for an independent review. And I think this is also, this is an issue that has particularly affected maternal mortality during this crisis. And I want to thank the chairs again for bringing that issue to the forefront and bringing more awareness around it. But I certainly would be interested in that data. I plan to request it. I guess if I have to foil it, I will. And then I'll certainly be doing a follow-up hearing in my capacity as the chair of hospitals. We have a couple plans for September. And I would look forward to any testimony, questions, or concerns you have that I might be able to address in the chambers or virtually.
Thank you.